myself and introduce myself and the committee. I am Dr. Liesl Neidiger, an assistant professor, and I am co-supervisor with Dr. Miguel Pinedo. And then we also have Dr. John Bartholomew and Dr. Nikitra Burse as Jaylen's outside committee members. And so how this will work is um, Jaylen will present for about 20-25 minutes, and then we will take probably like only 1 or 2 questions from the audience, and then we will ask everybody to sign off, and the committee will meet together and ask Jaylen questions and meet with Jaylen, and then we will be done for the day. So, any questions or anything before we get started? Okay, awesome. Well, take it away, Jaylen.
Cool, cool. And I'm just gonna minimize some of these things. I got my sister and my mom on host duty so they can continue to admit people. So thank you. 1 second. Okay. All righty. So I'm just gonna get started, jump right in. Thank you all so much for joining me here this morning today to do my dissertation defense presentation. And it is titled Birthing While Black, a qualitative exploration into the experiences and implications of the COVID-19 pandemic on Black maternal health and care, lovingly presented by yours truly. And at the end, I have my email. So please feel free to utilize the chat function as a way to put in any questions or comments throughout the presentation. And hopefully you'll be able to address at least one at the end. And again, reach out through email at the end as well. See. All righty, so just to start off with some language and positionality considerations, because in this presentation, the terms women, pregnant capable people, pregnant or birthing persons, and mothers are used synonymously in an attempt to account for the voices and stories in this study and to acknowledge all people who seek or provide any reproductive, preconception, prenatal, birthing, or postpartum care. Just a general overview of my dissertation. I will talk through the introduction and the background and sort of what led to this study. In this dissertation, I'll talk through the conceptual models for the dissertation, study 1 and study 2 results, and finally the combined findings and dissertation contributions. So to dive into this multi-layered health crisis, first we have the maternal mortality. So in the US, every year, 700 women die from pregnancy-related causes during pregnancy, birth, or within a year postpartum. And in Texas, it's specifically been reported how 8 in 10 Black maternal deaths can be prevented based on circumstances surrounding healthcare, as well as the treatment being received during this time. And for a visual representation of the US maternal mortality rates, we can see that national average at 23.8 deaths per 100,000 live births for the US compared to the Black mothers and birthing people's rates at 55.3 maternal deaths per 100,000 live births. And you can see based off of that national average, as well as the discrepancies compared to the across race. So for non-Hispanic white birthing mothers and people, as well as Hispanic Latinas. All right, and this dissertation was truly born out of wanting to understand these numbers now, but moving into the pandemic, and how every single time someone who was Black and pregnant felt ignored, unheard, or alone, created a window how care was being received or perceived as also in turn, it can be improved as we move forward. So next, the COVID-19 pandemic, and how since the onset of the pandemic and early analysis of these implications on Black communities, it showed an increased number of deaths and overrepresentation of Black people being hospitalized with COVID-19 compared to other races. And finally, the intersectionality and social determinants of health. And this type of research now requires attention to the complex intersectionality of pregnancy, gender, sex, race, and socioeconomic status, and how other structural inequalities have then magnified the COVID-19 in the COVID-19 era and this era that will follow. And this was able to be done by utilizing conceptual models for this dissertation, such as contributions to an adapted health disparity-driven stress process model, where we talk through different types of social characteristics that can socially determine one's stress exposures, And then the social resources and personal resources that one either has in place and access to, or not in place and does not have access to, that ultimately contribute to general health and mental health outcomes. For this dissertation, it was primarily driven, the analysis of it all was primarily driven through Black feminist thought and maternal health equity, as well as reproductive justice frameworks. So study one sought to explore the experiences of stress and coping and support for Black mothers in Texas during the pandemic and the care that was received within this context, utilizing content analysis through the stress process model, and then building off of narratives that can contribute to further exploration. Study two looked at the types of challenges and barriers to coping and support that maternity care professionals observed of Black perinatal mothers during the COVID-19 pandemic. So not only did this contribute to, again, what they were sharing in study one, but we got to get the perspectives of what it was like to provide care during this time. So just as an overview of the total dissertation, speaking with 64 individuals, study one, 35 Black mothers, and then study two, 29 maternity care professionals. And this page is just to honor the work and complexity that goes into qualitative methodologies. This dissertation specifically captured over 2,500 pages of transcripts, and in addition to over 130 hours of recorded interview audio files, and had multiple waves of analysis, like I mentioned, the narrative analysis and a directed content analysis. So study one is titled Carry, Labor, Love, Navigating the Stress Process, Well-Being, and Perinatal Experiences of Black Mothers in Texas during the COVID-19 pandemic. So this is just the page for the demographics and characteristics of those who participated in study one with the mothers. You see that general age of those, the majority falling between age 26 to 35, but also 20% who I spoke with were between 36 years of age and 42. This is a breakdown by education from some college, receiving some college education, all the way to advanced level degrees like master's degrees and doctoral level. Current employment sort of embodied the idea that mothers who were currently working or not working could still identify if they were either full-time, part-time, or currently on maternity leave, if applicable. This is broken down by relationship status, from married and seriously dating, and committed and partnered, making up the majority of those who participated in this study, as opposed to those who were divorced, separated, or identified as a single mother in this study. And for this last piece, we see a breakdown and a representation of household income levels at each of these levels, represented in this study for the Black mothers who participated. And for perinatal specific participant characteristics, more than half, so 57%, identified as being a first-time mother and giving birth for the first time during this pandemic. And two mothers specifically talked through how they gave birth across 3 decades. So in the early 2000s, in the 2010s, and then here in the 2020s. And they truly contributed something special to just a comparative analysis and a deeper understanding of what it was like to give birth in the pandemic compared to other times, compared to other times across their perinatal timelines. Then we have delivery location. So about 90%, almost 90% gave birth in a hospital setting, as opposed to giving birth in a birthing center or a home birth setting. And lastly, we have by delivery type. So 60% identified as giving birth vaginally, and this was either through an epidural injection shot, so for pain management, or giving birth naturally. Oopsie. And then for 40%, receiving a C-section, and this was either through an emergency C-section or a scheduled ahead of time and planned C-section. So this national stress exposure timeline was developed directly out of sentiments shared by the mothers and birthing people in this study. And they identified these areas across their timelines of being pregnant or giving birth, that things were going on in the world that were impacting their day-to-day lives and their decisions and habits, and affecting their well-being. So these were things like here in 2020, the murders of Breonna Taylor and George Floyd, as well as the loss of other Black lives during this time. And this ultimately led to the summer of nationwide Black Lives Matter protests. And this is all given the context that the beginning of the pandemic and the shutdown here in the US of the shelter in place began at around the same time. We then shift to February 2021 as a whole, the snowbid and the winter outbreak that hit Texas that displaced so many different families and again affected the day-to-day decisions and of the families that participated in this study. And lastly, in this last year of 2022, things like the mass shootings at Buffalo Supermarket and the Uvalde Elementary School. And at a policy level, the Texas abortion trigger law and the overturning of Roe v. Wade. And I think I skipped over one right here, the nationwide coverage of the infant formula supply shortage. So for mothers who sometimes did not have the capacity to breastfeed or body feed, or a choice to want to utilize infant formula, this was also another thing that impacted their day-to-day lives and well-being throughout this perinatal process. For this was generated to represent the cities and the state of Texas of the participating Black mothers. I know there's a lot of Texas city and hometown pride, so I made sure I had those listed there on the left-hand side. And then for a visual representation, we can just sort of see how mothers were coming from these metropolitan areas here in Texas. So the greater Austin areas, San Antonio, Houston, and Dallas, and where they would fall on this map. And after the first waves of analysis and contributing to some major findings within narrative findings, we have the 8 dimensions of well-being of Black mothers that were developed. And this is broken down into physical well-being, emotional well-being, social well-being, environmental, intellectual, occupational, financial, and spiritual, and categorized in ways of things that challenged it and experiences that mothers directly shared that challenged their well-being in these dimensions, but also things that cultivated it, things that nurtured it and allowed it to improve and grow over time. So just for sake of time, I'm just going to focus in on one or two or a couple of these. So for emotional well-being, these experiences talked through from the mothers and captured trauma and loss and death, events of racial injustices, perinatal distress, everyday discrimination, and then the burden of asking for help. And so one of the mothers who gave birth for the first time here in 2021, she talked through how, I quote this, "I think it was COVID. I think it was the killings of unarmed Black people. I think it was my situation. Grad school, I'm fighting racism with my professors, I'm fighting racism with my peers. But I think that plus being pregnant, plus the hormones, and how all of this and sort of living with an intersectional sort of array of identities during this time, through the racial injustices and the pandemic, these were symptoms of pregnancy anxiety that she was experiencing that was never screened for, never treated, but also not being able to be addressed even throughout the perinatal process into the postpartum period. And so that's one end of the spectrum on things that challenged well-being, emotional well-being for this study. Other examples that came out was this other end of things that cultivated emotional well-being, like psychological safety, trust and authenticity with the families and their partners, and then extended to community and service providers. So this mother who gave birth in 2022 for the first time, she talked about the importance of having a shared identity with her provider. And she says, yeah, I definitely wanted a doctor that was well-versed and kind of an expert in high-risk pregnancies. And that doctor had to be Black, a Black physician. That was a non-negotiable for me. And so we began to understand what these mothers were sharing when it came to acknowledging what it meant to feel psychologically safe and emotionally safe and have that trust with their provider, and how shared identity contributed to that trust, given the history of medical treatments and medical mistrust with certain Black communities, especially for Black mothers and birthing people. And this was directly tied to intellectual well-being. And one of the major components that contributed to what challenged intellectual well-being were examples of obstetric discrimination and racism. So obstetric racism and discrimination rest on the fact that racial hierarchies have led to differential practices and tasks and clinical decisions, especially with marginalized communities and Black mothers, especially during in history. Given all of this and what was shared in this study, it was routinely described as racist overt and covert treatment from healthcare providers and their clinical staff, including the withholding of information about treatment choices, refusing to listen to their concerns and symptoms, treating them dismissively and disrespectfully, and shouting at or threatening them even during the delivery processes and into their postpartum period appointments. For this study, a mother who gave birth in Houston in 2021 talked about not having a say and what it meant to not having a say in her birthing process. She said it was a traumatic experience for me and went from thinking she was going in to have a natural delivery and a vaginal delivery to being forced to have a cesarean section, so a C-section, and how it wasn't a good experience for her. This next mother talked about not knowing her options when it came to labor and delivery. And so getting there and getting ready to have her daughter, she said, I kind of just felt rushed and towards the end by my doctor, and I didn't really know all of my options and they weren't laid out to me. So this was an unawareness about if she could give birth, not only that a hospital wasn't the only option, but she didn't know that you could give birth at a birthing center. And so what challenged intellectual well-being for these mothers in this study were examples of, again, discrimination, obstetric discrimination, vaccine choice, blatant disregard for birth plans, unawareness of perinatal care options, dismissal of spoken feelings, and then a dehumanization throughout this timeline of being pregnant and giving birth. And then next we have what cultivated intellectual well-being for this project. So these experiences were grouped into receiving perinatal education and information to make knowledgeable decisions for themselves and for their family with autonomy and respect. This mother talked through how birthing care and support options and autonomy contributed to this idea. And she says, so it went all back to my choices, knowing my options, and again, having that support. And I think after having birth now 3 times, there are different pockets of support that are needed in giving birth. There's a certain thing that I need from my physician. And so she talked about working with midwives for her previous pregnancies. And she said how I felt heard. I felt the care was really centered around me and the baby and not just the baby, and that those little things meant the world to her. So having the support of my medical team, my clinical staff, and then my personal support from my partner, my doula and birth coach, and my family, any and all of that, it matters. And so what this was able to do was highlight the importance and the roles of care providers, of clinical teams and medical staff, and their support and advocacy for these mothers. So again, this inspired sort of the push behind doing study number 2, which was caring for the caring, exploring the roles of birth work and maternity care professionals and the perinatal experiences of Black mothers here in Texas during the pandemic. And to talk through this, so some characteristics by profession type, I got to speak with city public health officials all around Texas, doulas, lactation consultants, maternal health and care researchers, mental health therapists, certified nurse midwives, and then registered nurses. The majority of folks who I talked with served Black women and people here, but also identified as Black and majority identified as cisgender women. And these conversations, they came about by through focus groups. So about 5 focus groups with a total of 21 participants, and then in-depth interviews, individual interviews with doulas, midwives, and certified and registered nurses that, again, serve Black mothers and people. So major narrative findings that spoke to what it was like to provide care during this time to these mothers was grouped into navigating birth work both before and during the COVID-19 pandemic into areas such as the call, like the journey to the line of work, the work itself and the services being provided, the barriers. So these are things that got in the way of providing those services and the challenges on the job and the support that would be needed. And then finally, the outlook. So this had to do with legitimizing the profession, prioritizing Black maternal health in terms of the future of healthcare practices and political systems. So just to touch on 2 categories, such as the call, this was said by a full spectrum Black doula here in Texas, and she talked through the history of traditional birth work and doula work when it came to her time as a professional or finding her way to her profession. And she says, my people in my lineage were out there doing doula work, and the way that the hospital system actually grew and became to be what it is today was one of learning from midwives and doulas, but then taking that knowledge and creating barriers. For example, if you were not white, you could not practice. So then Black folks were not able to become doctors or work within hospital settings. And this set up home births, midwives, and doulas to be viewed now as unsafe environments. So just knowing some of the legislation and the barriers that have been put in place to have birth work where it is today just sort of feels like creating more barriers for people who are trying to get into the work and the field again, who look like us. So when she talks through what the legislation and the barriers were, these are the certifications now being required for doulas to enter certain spaces within hospital access, and having the privileges to be able to be there by their mother's side that they are serving. And then this general criminalization of midwives and doulas all throughout the US, and especially here in Texas, and what it means to navigate those spaces and barriers. And so when talking about this category, and grouping into the experiences that fell into it, they were all determined to demystify the pregnancy, laboring, and postpartum processes that make space for mothers and their families to be vulnerable, educated, and supported. Next, we have the work category, and this was said by a certified nurse midwife who talked about how in midwifery, that's our motto. It's to listen to women. I really feel like that's emblematic of what we do. I think our perspective is very focused on being engaged with the woman as a partner in her pregnancy, birth, and postpartum experience, rather than as just someone that these experiences are happening to. That we're not the expert, but we're truly engaging with her. And we want to educate her so that she has a lot of knowledge when we get to the point of delivery, and that she can ask intelligent questions and she doesn't feel lost by the environment or what's going on in the process. So when talking through these experiences with the professionals, they spoke about their best practices and then mitigating the loss of humanized care, both again, before, during, and post this height of the pandemic. And then finally, we are at the last section of my dissertation, which talks through the steps toward maternal health equity and gathered the shared experiences and perspectives of Black mothers and maternity professionals on the well-being and safety during the pandemic. So these were combined findings of all 64 individuals who participated, and this will be paired with the dissertation's contributions. So this has been broken down into 3 sections, and this first one is pandemic perinatal experiences and the gathering of them. And a comparative analysis was done for both study 1 and study 2. And this was able to break down, again, across the stress process model as a content analysis, looking at the stress exposures and getting examples like you see on the left-hand side, mother data examples that they talked through were major stress exposures during this time, and then maternity care professional data examples that not only supported what the mothers were saying in study 1, but built upon it and contributed to a better and deeper understanding. And we see even down at the bottom how this was done also for psychosocial resources and the support and the coping, both emotionally and behaviorally, that was provided or accessible. And so this in general talks about the power behind incorporating perspectives of experts in the field of Black maternal health, such as the Black mothers themselves and those that primarily serve and fight for them. And by doing that type of work, this was a diagram that reflects the qualities and characteristics of respectful maternity care shared by all of the participants in this study, and what this type of care embodied. And this multidimensional safety, just to bring your attention to, was able to tie back to study 1 and thinking about the multidimensional dimensions of well-being and what it meant to cultivate those dimensions of well-being, and now what respectful maternity care embodies with safety on each of those dimensions and levels. Second, we have community research and analysis. So like I said at the beginning, Black feminist thought and reproductive justice frameworks contributed to the foundation of this dissertation. And by doing that, I was able to create an operational definition of maternal health equity that guided this study. And this was, like you see in front, clinically and culturally competent quality care with equitable and just health decision opportunities, regardless of gender expression, level of income, education, occupation, race, or ethnicity. And so by bringing all of these together and being able to form these types of definitions and thinking through what it means to do this work on other populations, this allows for an intersectional lens through which Blackness, womanhood, and bodily autonomy can be seen and advocated for. And finishing up with the transformative models of care and thinking through how to apply, again, these last definitions and these types of studies and their implications for transformative models of care. So this birth justice safety circle was developed as a social, emotional, and cultural contribution to future models of care. This support piece, and these are sentiments from mothers and birth workers, talk through now establishing relationships with other mothers and other communal mothers and birth worker professional communities and creating foundations of comfort when seeking support. Autonomy had to do with being encouraged to speak up when experiencing mistreatment or violations of personal safety when receiving or providing care. And this includes the ability to have an advocate present to do so. We then have faith, and this had to do with acknowledging, accessing, and offering various formats of spirituality and healing practices. And lastly, we have equity, and this had to do with receiving culturally congruent care and education around Black maternal health and the unique perinatal experiences of Black women and birthing people. And this would be provided both, again, through professionals as well as mothers themselves. And to wrap up, this was said by a mental health therapist, a Black mental health therapist, working with mothers that spoke to this birth justice safety circle and its components. And she says, the biggest thing I think that every one of my Black perinatal clients has said is that they need support, and not just blanket support, but support with the day-to-day. And what she's commonly come across, and when she asks what kind of help they need and they answer, they almost immediately take it back like it's not something that they deserve or can have because no one ever extends it to them. And so this support, it's the tangible things that they can feel and they can experience. And it reminded her of the old school before her time and before her mom's time and her mom's time, how the community truly rallied around you and had people bringing over meals, coming over and watching the other kids even. But they don't have that type of support right now. And I think that the pandemic even caused it to be more isolated. So even if you did have people to provide it, you couldn't truly reach out to them due to not feeling safe during this time. And so needing people to be there and people to show up and do things without mothers always having to ask, was this return to an old school community-based mothering support system? And that can contribute to transformative models of care in the future. So with that, I just want to say thank you so much to my superstar dissertation committee, Dr. Bart, Dr. Pinedo. Thank you so much for mentoring me and trusting me in every sense of the word. Dr. Burse, all the way out in Mississippi, thank you for taking me under your wing. And I can't wait to continue this work with you as a role model for me. Dr. Neidiger, I can write a whole nother dissertation on what your support and guidance has meant to me. So thank you for pushing me and inspiring me. And then answering all of my questions under the sun with kindness and patience. I got future Dr. Raven Pierre and every mother and maternity care professional who participated in this. Your contributions are the reasons why I was able to successfully do this dissertation. My Holy Family friends, high school, A&M, UT Austin, and then over general city of Austin area people. Thank you for allowing me to continue to recognize myself, keep my joy and my sense of humor throughout this process. Lastly, my family. I gotta take a breath. So my mom's side, my dad's side, everybody in between, upper right-hand corner, my angels who are not with me here physically, but are here with me every step of the way spiritually. And then my core four right there in the center. I wanna say thank you to my sister and my dad, who I was able to talk their ears off at all times, and my Auntie Fanny, I talked her ear off all the time about this work and this project. And lastly, I hope this dissertation can serve as a love letter and a dedication to my very own Black mama, who matters to me and so many others. So Heather Wright, thank you so much for sharing the love and the light that lives in you with so much beauty and so much grace, but then teaching me and my sister how to do the same. With that, I'm done. Okay, thank you so much.
Wonderful. Thank you so much, Jaylen. Excellent job. I think I can speak on behalf of everyone that it's very impressive work. With this, we just have a little bit of time for questions. Does anybody, we'll take maybe one or two, depending on how long they are. Does anybody have a question for Jaylen?
Oh, I thought I ended the call. Just trying to stop sharing. Ooh, oh, now I can see you all. Oh my gosh. Oh, beautiful, beautiful. Let's see.
I guess I should specify non-committee member that has.
Oh yeah, and I'll save the chat so I can see all of this later. Oh my gosh, you guys are all so beautiful. This is great. Thank you so much.
Okay. Well, with that, hearing none, I just want to thank you all for supporting Jaylen through this process. Getting a PhD is a lot of blood, sweat, and tears, and you can't do it without your family and community. So thank you all for being here for him. And with that, I will ask everyone to sign off except for the committee, and then we'll have a conversation with Jaylen. And if you have any questions for Jaylen that come up, feel free to email him. With that, I hope everyone has a wonderful day. Thank you so much.
Thank you, thank you, thank you, thank you.
Like me, huh?
Oh, thank you. Love you.
Love you, son.
Love you.
Hi, Jaylen. It's Carol.
Hi. Oh, Miss
I
Carol.
was able to log on. Great job.
Oh, thank you so much. This means the
Bye.
world.
Bye-bye.
Bye.
Bye, Jaylen. It's Thais. I'm so proud of you. That was amazing. I'm in tears right now.
Oh my goodness. Bye, Thais. I hope to see you soon. Oh my goodness. Thank
You
you.
too. Good job.
Thank you. Hey, Uncle. Thank you for being here. I think, oh wait, Mrs. Alessandri. Thank you, Mrs. Alessandri. Should I made a breakout room as well. I didn't know if you wanted to utilize that.
I don't think so. I think you might just need to remove people. Yeah, if that.
That's my
Um,
on Janetta. Let me just
and then we'll put you in a breakout room. We'll
oh,
put.
I'll go.
Yeah.
Oh wait, let me make you I don't think I made you co-host.
Okay.
Okay. And then I'm just gonna move. Oh wait, don't report to Zoom. Okay. And then thank you, Deb. Appreciate you being here. And then thank you, Nadia. Hope to see you soon.
Good. I'm going to stop recording now, if that's okay.
Yes, perfect. Thank you.